The following ShishMed podcast is a production of drpodcasting.com.
On this edition of the ShishMed podcast, we visit with Leah Shepard, Kate O'Rourke, and Reshma Stone, all of the Einstein Healthcare Network, as we preview an upcoming session at ShishMed Connections 2019 in Nashville on stakeholder collaboration, working across the aisles in positioning service lines for growth and sustainability. And that happens right now. This is the ShishMed Podcast, Rapid Insights for healthcare strategy professionals in planning, business development, marketing, communications, and public relations. I'm Bill Klaproth. In this episode, we preview an upcoming session at ShishMed Connections Annual Conference this year, September 8th through the 11th, 2019 in beautiful Nashville, Tennessee. The session is titled Stakeholder Collaboration, Working Across the Aisles and Positioning Service Lines for Growth and Sustainability. With me is Leah Shepard, Associate Vice President for Marketing in the Corporate Marketing and Communications Department, Kate O'Rourke, the Senior Director, Physician Liaison Services, and Reshma Stone, the Associate Vice President of Strategic Planning and Business Development, all from the Einstein Healthcare Network. Leah, Kate, and Reshma, welcome to the ShishMed Podcast.
Thank you. Thank you.
Well, let's get this party started. Ladies, we start every episode of the ShishMed Podcast with rapid insights. One quick tip someone can use to make their marketing better today. Leah, you're up first. Hit us with your rapid insight.
Sure, Bill. I would say that knowing when a service line is actually ready to go to market is as much about operational and clinical readiness as it is about available marketing dollars.
Ooh, I like that rapid insight. Leah, thank you. Kate, your turn. Give us your rapid insight.
Great, thanks. For me, who my primary audience is physicians, I would say the most successful tactic that I've used is building trust with the referring providers. I over-communicate with them. Even if I don't have the right answer that they're looking for or it's not the answer that they want, I'm always honest and I'm over-communicating. They rely on that. They rely on that from me. And so it's easy to get their business when you have their trust.
Over-communicating is never a bad idea. Thank you, Kate. Okay, last but not least, Reshma, you're up. Give us your rapid insight.
Sure. I would say rapid insight to making marketing better is to really create consensus with a group on what services to market and sort of how to market it. We always sort of need to meet the consumers where they are. For example, if you're trying to capture the millennial audience, meet them online on the various social media platforms that they utilize in the their day-to-day life. Each consumer group behaves so differently, and as a health system, we really need to aim and to engage and interact with them accordingly with targeted information.
And that's how it's done. 3 great rapid insights. And Reshma, you're so right. Consensus building, always a winning tactic. So ladies, let's talk about your session coming up at ShishMed Connections 2019. Stakeholder collaboration, working across the aisles and positioning service lines for growth and sustainability. Reshma, can you tell us how this topic was developed?
So we were really looking for ways to grow our volumes and increase market share capture. It was part of a bigger planning process about sort of growth and sustainability for our hospital, and that's sort of how Kate and I really got to working together, and it turned into this really, really extraordinary journey, and so that's sort of how we came up with this topic.
Well, this sounds like a great session, so let's dive deeper a little bit into it. I know that you'll be discussing 3 objectives to help hospitals connect across the aisles and away from traditional silos and toward internal alliances. Reshma, let's stick with you. Tell us about learning objective number 1, which is learn how to take a deep dive into the performance data of your service lines to understand the environment and trends. Can you tell us more about that?
Sure. So, Bill, as you can imagine, with health systems, there's just hundreds or thousands of data points that you can analyze. And in my role here in strategic planning and business development, we're constantly being asked for different data. And I think, sort of we took a step back and we said, what are some of those data points that are going to be most impactful? What are those data points that we really need to look at before taking something to market? And so we decided collaboratively as a group sort of which ones to look at. Some of the things that we looked at, I'll share more in depth at our session, but as you can imagine, it's the big hitter. So trying to focus in on those high level things. So market share and volumes, utilizing data related to that, looking at physician referral behavior and seeing where we have opportunities to increase keepage or reduce leakage. We looked at financial performance because that's very important to us, looking at contribution margin per case and total contribution margin, taking a look at all of those financial indicators. We looked at, is the service line ready in terms of, do they have access? Can they get somebody in the door? We don't want to be marketing somebody that, may have some issues there. We looked at projections. So what's going to happen in that service line over the next several years? Are they expected to grow? Will they be shifting to the outpatient or a different setting? So we took a look at some of the projections. We took a look at, do we have the right staff in place in terms of leadership, administrative, and clinical, and we took a look at competition. What is our competition doing? Do we need to respond a certain way? And so we took a look at all of these different things, and we sort of outlined them all and looked across all of these things in all of our service lines to really help us understand which ones we were able to sort of tier in our system that we developed.
Yeah, that sounds really good. So it sounds like learning objective number one is understand the performance of your service lines, which brings us to learning objective number two. Kate, we're going to bring you in here,
Sure.
which is learn how to analyze market performance and develop a flexible system for categorizing service lines into tiered levels of support from corporate departments. Tell us more about that.
Right. So, you know what, working so closely with Leah and Reshma all this time, it was kind of a light bulb moment. Data drives everything in healthcare, so why would we not use it to make informed decisions about who receives the next outreach initiative or who gets a radio spot? As Rush said, we pulled together a lot of different data, sifted through it, and came together with senior leadership to kind of determine what were the most important and impactful points of data that would help us hone in on who should receive, certain services from our departments. And so, we broke that down into three different categories, which, again, we will get more into, the how and the why in our session, and how we developed a naming convention for them and tried to be really thoughtful about how we would roll this out and communicate this to leadership and to the department head chairs. And so because we had all of this data behind us, it was, a lot easier for us to communicate that to all of the different stakeholders within the organization.
Yeah, I like how you put that. Analyze the market performance of your service lines to help you determine who gets what. And that leads us to learning objective number three. Leah, we're going to bring you in here. Learning objective number three is hear how stakeholder collaboration promotes broad and transparent communication, resulting in buy-in from senior clinical and administrative leaders. Leah, tell us about that.
Sure, Bill. So after we analyzed the data, we had to think about how we were going to fundamentally shift the process and structure that was in place. And as you can imagine, some of that structure was basically hearing the squeaky wheels or hearing a department say we have a new program or a new service or a new physician coming on board, and those departments would ask our departments for support. So this was part of the process to say, hey, how can we realign those requests so that they fit within a more structured and tailored process, something that would allow everyone to collaborate and hear how the data drives the process. So the intentional design of this process to promote broad and transparent communication across the organization was key for us. So from department chairs through hospital VPs and practice administrators, no one's in the dark, and the priorities are agreed to for overall alignment.
So what we just heard about those three objectives in this session sounds like a great roadmap. So my roadmap is, number one, I'm going to learn how to understand the performance of my service lines. Number two, I'm going to understand how to analyze market performance to organize them into tiered levels, or who gets what. And then number three, I'm going to learn about stakeholder collaboration, which will result in buy-in from administrative leaders. So Kate, is this how you design this, a roadmap for attendees to walk away with?
Yeah, I would say it's been a really, really useful tool for us, and it's been, like Reshma said, it's been a real journey for us. We will talk more in depth about who needs to be at that table to review all of this data, and then some of the metrics that we use to prioritize the service lines. And as I said, the naming convention for the categories that the service lines are added to, and how to roll out that process so that you're successful, and hopefully you'll get the same response that we've had so far, which we will also talk about in our session. And we hope to see you in Nashville.
And we will see you in Nashville. It's going to be a great time, and a lot of learning is going to take place. The session is titled Stakeholder Collaboration, Working Across the Aisles in Positioning Service Lines for Growth and Sustainability. Leah, Kate, and Reshma, thank you for your time.
Thank you.
Thank you, Bill.
Thanks, Bill.
And you can learn more from these speakers, plus 70 plus other sessions in healthcare strategy, specific to marketing, digital engagement, communications, public relations, strategic planning, business development, as well as career and leadership development at SHISHMED Connections this year, September 8th through the 11th, 2019 in Nashville. To learn more and to view the conference agenda, visit shishmed.org. That's shsmd.org. Then click on the annual conference tab and register today. Early bird pricing ends July 10th. If you found this podcast helpful, make sure to share it on your social channels and be sure to check back soon for the next SHISHMED podcast. I'm Bill Klaproth. Thanks for listening and see ya.